All right, so I want to talk to you a little bit about challenges you face with patient communication. Besides, a patient being illiterate, do you ever face other challenges of them kind of fighting you or telling you you're wrong? Or
Well, we do get patients that don't get well quick enough because they don't understand how serious some of these diseases are. That get very irritated and very irritable, and you have to find effective ways and calming ways to deal with those patients. And what I mean by that is you can't be if they're ugly or mean to you, you can't just be ugly and mean back. I mean, that doesn't solve the problem because they're scared. You have to recognize these signs. So you may do something as not as gentle as, "Hey, Alex, tell me what's going on. Tell me what you're feeling right now. Like what are you afraid of? And a lot of them will tell you that they're afraid of dying. They're scared they're going to die or whatever. And I think one of the challenges that any healthcare giver has is that you may recognize the fact that it may not be the infection that they have right now, but their underlying illness is not getting better. And you have that perception of that they have that this may not get any better and that death is inevitable, and it's very hard in young people. And as a healthcare provider, whether you're a doctor, nurse, research coordinator, whatever you do in the healthcare, you do see a lot of people die, and you have to, you can't just give up on them on their deathbed. You have to be able to communicate dying with them, and you have to give a piece of yourself without and knowing where to stop. That you can't give 100% of yourself, but you sure try the best you can and be with them and help their families. I think that's probably one of the biggest things is helping their families deal with this. And then on the happier note, the patients that do get well but need to continue to take a similar drug that we're studying for the next maybe 10, 12 months, which they do a lot of times, and now they're having to pay for it out of pocket, a drug that's already had approval, um, because the testing drug doesn't have approval. These drugs are very expensive. Some of these drugs just cost a fortune, and the patients say, "I can't afford that," and they say, "I don't see any way I can take that." Well, I could say, well, if you don't take it, you're just going to die, but that's kind of like ridiculous. We've come this far. It's my job to find a way to get them the drug that works very similar and help them find a way to afford it. So that's when we call in social workers. We call drug companies. We deal with all kinds of things to try to get patient medicine. I would never let a patient leave without knowing that they were covered by a drug.
do you believe that's something that all physicians do, or do you believe that in terms of communication, that's something the hospital needs to work on as a whole?
I would say that I have never seen a patient discharged, and I've been here for a long time, and I've worked in the HIV clinic for years, and we never turned a patient away that needed medication. We found a way to get it for them. We, and I think at the hospital, we do the same thing. Now, whether or not we continue to help that patient find ways, we give them the information. It is up to the patient to go from there. But I think most of the time we can get them through it. Now, the other issues are we have patients that are non-compliant. They like maybe might be on a study or they might not be on a study. Let's say they're not, but they've got a drug that we've worked really hard to get the ways for them to afford it, and then they don't go pick it up at the pharmacy, and I find out. And
Do you think that's a product of poor communication from the doctor?
no, no, I think that's
Maybe poor communication from the patient.
poor communication on both parts in a way. But poor if the medicine is making the patient sick, it's their job to call us and tell us I'm having a hard time taking this because I'm throwing up when I take it, or something like that. Well, I don't know that you're throwing up with taking this until you tell me. So I have to know that. So if you are, then maybe I can find ways to lower that dosage of medication for you, or give you something, or give you ways that can help you take this medication without having that horrible nauseating feeling. And then sometimes you have to be really straightforward with the patient and say, do you realize the seriousness of your illness, and that if you don't take your medication as we have prescribed it to you, that you're going to die?
You'll say it just like that.
Yes, but more or less, I say I sugarcoat it, but no, I really do have to get really serious with a few, not many, but I say if you do not take this medication, you're going to get sicker, and these drugs will no longer work, and you will die. And that's pretty much a given, because there are some infections that you can't return from there's only so many drugs out there for certain types of diseases, and thus is the reason for research. So when you've used up the gamut of drugs and they don't work anymore, you're out of luck. And a lot of times the patient has done that on their own by A, not taking their medication until it's completely gone, B, skipping doses of medication, so you build resistance. That's true in every, type of medication. But it's also my job to make sure that the patient understands completely, and the doctor as well, that the patient should know to continue to take the medication until we tell them to stop, or until the medication is completely gone out of this prescription.
Do you think that is one of the most important things, that physician to patient communication, is that one of the most important aspects that need to be improved on? Or are
Yes, and
there other things that we should be focused on?
I'm sorry, and other things we should be focused on
besides that?
I think that has
I have to conclude everything here.
Right. Well, I think overall, whether it's research, whether it's in the clinic, and I think UAB is working really hard to perfect that. Like when a patient checks out, forget research for a second, but when a patient checks out at the desk at UAB, any doctor they've seen, they get a printout sheet of all their medications and how to take it, and it's checked at every visit, and listing of your vital signs, listing of emergency numbers to call, pretty much everything that is a synopsis of what went on. And research is the same way. It's my job there are things we put in place here in research and all our studies, that we go through this gamut of questions, and allowing them to ask the questions, and giving them ways to contact us 24 hours a day, 7 days a week. Hoping they don't call us at 3 o'clock in the morning just to talk about their day. But, I guess I would talk to them if they did that. But, I think that is the most comforting thing, is knowing that they can reach someone, that they're not going to be left out there in the cold. And, as we all know, healthcare all the way around needs a lot of work, and drugs are expensive, and research is expensive. And that's kind of where it all falls down to, is that it takes a tremendous amount of money to put one patient on a research study. So it's my job as well as the doctors, and they really kind of leave it up to the coordinators. Coordinators really have a huge role in study patients. If we talk to a patient and we really know more about what to ask about, how compliant they appear to be, and that sort of thing, and we don't judge them. If I'm ever in doubt, I'll talk to somebody. But it's our job to see that we're talking about a patient that's really wanting to try this drug, wanting to get better, wanting to participate, wanting to make the world a better place. I know that sounds kind of corny, but it's really true, because if I can be a part of a study that can save the next person's life, well, I want to do that, or that patient may want to do that. It may not benefit them directly at the moment, but it will benefit somebody else in the long run. And you'd be surprised at the number of people that do that would participate in that. And it's commendable. The people that have done research and knowing that they weren't going to directly benefit from it, they would do it because they know that the next person could benefit from it, and they wouldn't have to go through what they went through. So I think we could all work together better. Communication is the key to relationships. So good communication is the key to any successful relationship, whether it be a personal relationship, a doctor-patient relationship, or whatever. If you don't communicate, my regular saying is, can't read your mind. I'm not living with you. You got to tell me what's going on. And rarely do I have to get real blunt with a patient, but occasionally I do. But I'm nice blunt. But if they're not going to do what I've asked them to do, then I just say, look, if you can't do this, then if you're not going to take your medicine, then why are you here?
Well said.
So because we want to make you well and help you, you need to help us to help you. So that's kind of it. It's healthcare.
Well, thank you. Thank you for your time.
You're welcome.
I appreciate it.
It's my privilege.
I think that's all we need.